these crazy things popping up here. Today we're going to talk, well, you know what? Here's the first mistake I've made. I forgot to change my title slide here. We're not going to talk about propolis today. We're going to talk about bee venom and hopefully royal jelly if we have time. Just a little, we got involved in beekeeping in 2010, and I really didn't want to do beekeeping. I was a school teacher. I had enough to do, and I just did not want to be part of this activity. However, I like information, and my excuse always is, oh, I have to learn it to teach my students. So I started reading the books that were laying around, you know, Beekeeping for Dummies, and really got involved in looking at hive resources and got interested in honey. And then I kept hearing this word propolis, and that got me even more interested in finding out what that was all about. So as we've gone through our beekeeping time, we've gotten interested in more and more things that are in the hive. And I guess the feeling that I have about all of this is that as beekeepers, we need to know the value of what we have. You know, if we don't know, then we can't tell other people. And if we don't know, we can't benefit from the sale of, if you're so inclined, those other products or value added products. So anyway, that's kind of where I'm coming from. And I'm going to talk to you today about bee venom therapy. And you know what? I don't have this in my full screen, do I? There we go. The one thing I can tell you about bee venom therapy is you've got to be miserable to want to do this on purpose. So just keep that in mind. It might not be something that you'd want to use, you know, for every little thing, but there are some reasons to do so when other things aren't working. So BVT, or bee venom therapy, is the process of using bees to sting, or an injected meter dose. Well, I'm going crazy again here. You will not find in the US meter doses being given to you by a physician. So our only choice in this country really is to do it ourselves with the bees. The other way it's used in this country as well is putting the venom in ointment and using it for either. There was a big popular movement about 10 years ago in Hollywood, and they were saying this is Botox in a jar, and you put the bee ointment on your face. The one ointment that I know about is called Venex, and I've tried it, and I will tell you, some people have said that it is very benign. I totally disagree. To me, the Venex makes my skin feel just like it had a bee sting. It burns, your face or wherever you put it heats up, and then when it starts declining, you start itching, and the itch goes on for days. So I'm not real fond of that, but some people are. Now, the bee venom therapy started out really in ancient Greece and China. They can trace it back that far. But today there are decades of research on bee venom therapy that you can read if you go to NIH.gov. NIH is the National Institutes of Health, and research from all over the world on just about anything you can imagine is published there. I will tell you that their search engine on the actual site is not great. And sometimes if you're looking up and you want to know bee venom and rheumatoid arthritis, you'll be better off to search it in Google first, or Google Scholar, and then look for the NIH.gov addresses on those results. What is the active ingredient in venom is called melatonin. It's a peptide, and they believe that is what is the active ingredient that does the wonderful things bee venom does besides make you sting. It's anti-inflammatory, it's anti-arthritic, and many other things that they have found. What happens with the bee venom is certainly externally you get instantly an inflammation response, you know, that swelling, the redness, the sting. But internally, once that kind of settles down, internally, bee venom activates the adrenal glands, which are on your kidneys. And inside your body, it reduces inflammation, it changes your immune response, and it boosts your immune system. it improves oxidative stress response. Now, the oxidative stress response is that part of our system where we've heard the words free radicals, and it's isolated oxygen molecules that run around our blood vessels and such looking for a partner. And as they travel through our system, they cause damage and ultimately disease. So dealing with the oxidative stress early, capturing those free radicals is better for us, because then we're not letting that disease system progress. Other things do the same thing. Propolis helps with oxidative stress. The CoQ10 and the vitamin C and things like that are some things that you find advertised for that. They've also found that bee venom inhibits tumor growth, and that was done in mice. So as you're looking at research, some of the research is done on human beings, some of it is done in a petri dish, some of it is done on animals. So you always have to kind of check and see what you're looking at. So probably the most used part of bee venom therapy is inflammation. It's very simple. If your knee hurts, you can sting at your knee. If your elbow hurts, you can sting at your elbow. You can also sting at the acupuncture points, which we'll talk about a little later. That gets a little more complicated, but certainly the inflammation part of it is where we kind of got started with it. My husband, Steve, got stung in the hand, right at the fleshy point between the thumb and the forefinger. And it was, I think, our first year beekeeping even. And we were sitting out on the back porch one day, and he's moving his hand around. He said, I don't have arthritis pain in this hand since I got stung. I wonder if there's something to that. So of course I jump on and start doing the research and find that yes, that's exactly what has happened. So he typically stings his hands now when they get really sore. So they use bee venom therapy, or they're researching bee venom therapy on different kinds of immune disorders. Arthritis is an immune disorder, rheumatoid arthritis, lupus, multiple sclerosis. Those things are all your immune system going haywire, where it's making antibodies against your own organs or your own tissue. And people use venom therapy a lot for these disorders. And sometimes people would get, 25 or 30 at a time, which is just crazy. But it is something that is practiced in our country by people that are desperate. When you have lupus and you're desperate, or you have MS and you're desperate, you'll try just about anything. And that's what people do. It's also used for other immune disorders that are not as severe, like allergy, asthma, and eczema. So that's another way people are using it. One of the big users of bee venom therapy are people that have Lyme disease. Of course, the Lyme disease comes from a certain kind of tick. And what happens with Lyme disease is it has a biofilm around it that makes it almost impenetrable by any kind of antibiotic. And so what happens is, and it suppresses your immune system to the point that you get other illnesses because of the Lyme disease. We went to a apitherapy conference about 4 years ago in Connecticut, Rhode Island. I can never remember where it was. And there were about 30 people in this audience of 80 that had Lyme disease and were using bee venom to treat their Lyme disease. I stood and talked to a young girl who had gone through this treatment, and she said her Lyme disease had gotten so bad that she had lost her ability to walk and gone blind in one eye. And she started this venom therapy, and they sting down the spaces between your spine, because that's where all the nerve roots are. And she said with 6 months of bee venom therapy, she now has all her faculties back, and her viral load is almost nothing. So these people are really, all about using the bee venom for Lyme. Another thing they use it for is neurological disorders, nerve things, and things that end up in your brain, or that your brain is causing a problem for. Parkinson's disease. Whoops, sorry. Keep bumping my trackpad. Parkinson's disease is one that they're really finding it does amazing things for the symptoms or the problems that are associated with that. Also ALS, which is Lou Gehrig's disease, and even Alzheimer's. They're having some success in research using bee venom therapy. I have got to move this out of the way. Hang on just a second. I can't see half my screen with this stuff in the way. That's better. So the way that bee venom is captured is that bees walk across an electrified platform at their hive, and it forces them to eject venom onto that glass screen. Now, to order these venom collectors, it costs about $1,000 for 6 hives. So it's not cheap. And then you put these glass plates on your hive at the entrance, and the bees walk across it to get into their hive. And as they go, they get a little bit of a zap, and it makes them sting. And the venom then is deposited on that clear glass. They say it takes 1 million stings to make 1 gram. 1 gram is the weight of a small paper clip. And 20 hives and 2 hours to get 1 gram. Now, you can sell it. It's $80 per gram. And, you know, if you want to go to this trouble, and this is what it looks like when they're scraping off the venom to collect it. And again, that could be used in a metered dose from a physician. However, that's not being done in this country. There is a market for it, however, for people that are making moisturizer, and it's used that way. So we're going to talk a little bit about how bee therapy or bee sting therapy is done. And again, I'm still trying to get this out of my way, but I guess you don't see it, so it'll be okay. So your only choice in the United States is bee sting therapy, which means you got to go out and get your bees. These are the things that you'll need to do bee sting therapy. These special tweezers, these long tweezers, you can find on Amazon, and they're really interesting. They're reverse tweezers. So when you pinch here where my cursor is, it makes the tip of them open, and you'll need those to capture your bees. Then you have to, you know, go out and get a jar of bees from your hive, and you only want to bring in maybe enough for that day, or maybe enough for 2 days at a time. And here we go again. You also want to have a first aid kit handy. That should include ice packs, Benadryl, and an EpiPen. And we'll talk a little bit later about the EpiPen issue. Now, you don't want to have to use the Benadryl, because the Benadryl will stop the benefits of the sting. However, if you're starting to have an anaphylactic reaction, you need that. So that's why that needs to be there. Ice packs are helpful before and after the sting. So also, if you want to know how to do your treatment, or how many stings it's going to take, or how long you're going to need to do it, if you go to this Facebook page, it's just called Apitherapy, and then go down here at the bottom where it says files. And if you click on that, you get a list of all the things that they have. And of course, I don't have the, whoops, I just cannot control this today. But you can start down the list. If you look at the very bottom thing in the list, bee venom therapy for chronic pain. And they will actually have written out the protocol for different kinds of things. Now, for instance, my husband only takes 1 sting, and he gets a month or so relief in his hand. I have done my shoulder several times. I used to be a school teacher, and I'd carry a heavy book bag and my purse on the same shoulder for 36 years. And I get what I think is bursitis. And I might do 2 or 3 stings across the top of my shoulder, but then I have relief for months. For things that are more chronic and ongoing, like back pain, or, you know, MS, Parkinson's and such, people will sting for long periods of time and use many stings. So this is how it's done. You stick that long tweezer in your jar, and you chase around the bees, trying to get the bees to catch a bee with that. I'm so sorry. Trying to catch a bee with your tweezers, and where you want to grab them is the abdomen. Some people try to get the wings, but if you grab them, I'm sorry, by the thorax, not the abdomen, in the middle, and pull them out. Now they suggest a test sting at the waist where you have a little, love handles there and a little bit of something under the tissue. You don't really need to do that if you're a beekeeper, because we all probably know how our bodies are going to react to bee stings. But if you're doing a family member or somebody else, you want to do that test sting at the waist on the side, sort of, and then just stick it in, pull it back, and scrape the stinger off. What happens is wherever you put the bottom of the bee, their abdomen down, they will sting. When you pull the bee away, the venom sac, which you can see on the right, and the stinger are left in your skin. And that old direction about not grabbing the stinger and pulling it out is because what you're grabbing is that venom sac. And if you grab that venom sac to pull the stinger out, you're squeezing all that venom into your wound as you pull it out. So they always tell you to use a credit card. And I always think, yeah, we've always got a credit card handy when we're out in the bee yard or, walking down the sidewalk, but really your fingernail will do the trick. So for a testing on somebody that's not a beekeeper, in and out right away. And then you just, observe and make sure that they're not going to have a terrible reaction. If once you're ready to sting, there's two different schools of thought. You can sting at the pain site. If your knee hurts, you sting around your knee. If your elbow hurts, you sting your elbow. The other school of thought is to sting at acupuncture sites. For us, people that aren't acupuncturists, that's kind of tricky because the acupuncture sites are so, there's so many and it's so confusing. It's just kind of overwhelming if you look at an acupuncture book. I have found one that is very helpful that I'll show you in a bit, that's more abbreviated so that you could kind of use that school of thought if you want to. You can also then leave that stinger in to pump for up to 15 minutes. Now, I myself know when I first got started, when we first started bees, when I got stung, I would get a huge lump. That is not anaphylaxis. That is not an allergy to bees. That's what it's supposed to do, is you'll have a big site reaction. So when I first started getting bee stings on purpose, I would only leave the stinger in for 1 to 2 minutes. If I left it in for 15, it was way too much. I would get this huge swelling and it was red and sore. And then once it started to go away, it was really itchy. So, you have to kind of think about what your reaction is to bee stings and go from there. And you should start with 1 or 2 and work up to no more than 15. So just think about your site that you're trying to treat. I do 2 or 3 on my shoulder. Steve does 1 on his hand. I am going to eventually start doing this regularly for my back pain. And I would anticipate probably 6 to 8 I'd work up to sting at the sites where I have pain down my spine.
Jeannie, quick question for you.
Here's some things that we've learned that have been very helpful. Icing before and after helps. Putting propolis oil or tincture on the sting afterwards helps kind of calm it down. And again, you'll have to figure out the number of stings and the length of the treatment. I know treating my back pain is going to be a long process, months, I would imagine, before I really start seeing the difference. And also you can do what's called mini stings, where you actually pull the stinger out of the bee with little teeny tweezers, and you hold on to the top of the stinger and then sting around something with just little tap, 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 taps. So you don't actually let the stinger go way into the skin. That can be useful for getting rid of things like a mole on your face, or somewhere where you don't want the swelling to get really big, or when you want, let's say you're just getting started with bee stings, but you've got 6 or 7 sites that you want to be able to sting at, you could use one stinger and sting in little mini stings up and down your spine, maybe on both sides with that one stinger. And then you're not overdosing yourself on bee venom. And again, as I told you before, if you can help it, don't take Benadryl. Only take Benadryl if you feel like the reaction is getting out of control. The lower right hand picture is what most of ours look like on our back. That's the amount of swelling that we get. But even if you get a bigger swelling, like on an arm or something, as long as your throat isn't closing or you're not having trouble breathing, you're good to go. And it's really not an allergy to bee stings. These are some things that we've tried bee stings for back pain. And again, I don't feel that we have done it long enough on my back yet. Doing bee venom therapy, if you're trying to do long-term, is kind of a problem when you're not home all the time. You're going out of town and traveling and things like that. And it's like, how do you have your bees with you all the time? So it's something that you really kind of have to think through. And how many times am I going to do this? And how long is it going to be? And where can it fit into my schedule? We've also used it on moles. Our business partner, Lori, had a big mole on the back of her neck, and she stung it every other day for about a week and a half, and it completely dried up and disappeared. As I said, we've used it for arthritis in my husband's hands, for bursitis in my shoulder. And again, the right hand picture kind of shows you there stinging on somebody's back. Now, here's some issues that I want to talk to you about too. I would caution you to practice bee venom therapy on others. There's a big liability issue. This isn't licensed in anywhere in the US. And I really think that if you're stinging other people, there could be a big liability issue. Now, a lot of the people that we talked to at that conference did do bee venom therapy for others, but most of them were licensed acupuncturists. And so they know a little bit more about what they're doing maybe than we do. But no matter what you do, if you ever decide to treat other people, you always should have a consultation. There's a video out there that you can show and paperwork to sign. My suggestion is that instead of doing BVT on someone else, train that person or a family member they bring with them how to do it. That takes away that liability of you doing it. Obviously I can't sting my own back, but if I was going to get some training, I could take my husband with me and they could train him how to do it. If you want to charge people for your time for the consultation, you can certainly do that. And you can also charge people for the bees. And that's another way for an income, but you're not actually doing the stinging. Well, I'm not sure where this came from. My background seemed to have disappeared. These are wonderful, wonderful resources for, well, once again, wonderful resources for anybody that's interested in bee venom. Health in the Honeybee is written by Charles Mraz. He is sort of the father of American beekeeping. He was just a beekeeper, didn't have a lot of credentials, but he started doing bee venom therapy on different people that he knew, and eventually came to the attention of some surgeons at, I believe it's Johns Hopkins in New York City, and they started working with him and trying bee venom therapy on patients, and were just very blown away by what it can do. Charles Mraz's philosophy is to sting where it hurts. That's all he does, sting where it hurts, and sting as long as you need to until it doesn't hurt anymore. Now, the other school of thought with acupuncture points is a little different, because sometimes the acupuncture points are way far away from the part of the body that hurts. And it's kind of confusing, like, why would that help? But I know one of the problems that I'm having right now is trouble with my sciatic nerve. And when it starts firing, it hurts all the way down the back of my leg and all the way down my calf to my foot. And one of the acupuncture points for that is at the top of your under your kneecap at the top of that leg bone. And I find that if I push on that, just using acupressure, that actually helps calm down the firing of it in my back. And the reason is that is a connection point for the nerve and the muscle going down my leg. This acupuncture points quick guide is really helpful because it shows one acupuncture meridian at a time, and then the author picks out 2 or 3 important points, the most used acupuncture points. So there might be 15 or 20 points down this meridian down your body, but she's only going to suggest 3 to actually treat with. And so that makes it a lot less overwhelming. What I did with my book is I went through with 2 different color highlighters, and I highlighted one set of symptoms for myself and the acupuncture point that treated that. And then I went through it with another color for my husband. And then when we do it, we have that reference. And the other place to go, of course, is nih.gov. And I've got these here. The couple of other really helpful websites are the Apothecary blog spot. That will give you in your email about twice a week some piece of research on one of the beehive components. It could be honey one day, it could be bee venom another day. If you want I'm just having a terrible time, I'm sorry. If you want the best book out there on all of the bee resources, go to this website, FAO.org. Here we go again. FAO.org is the Food and Agriculture Organization of the United Nations. And when you get to that site, you have to search very carefully exactly this title, Value Added Products from Beekeeping. If you don't type it in right, it's not going to find it. And what you will get is about a 200-page long booklet online that tells you about every single beehive resource there is, from bee venom to beeswax to propolis, and it will tell you what it's made of, how the bees make it, where it comes from, how to harvest it, how to clean it, how to make things with it. It even gives you recipes for propolis oils and tinctures and things to do with honey. And it also gives you a market peak to, is it selling in your area? What is it selling for? What is the normal public interested in? So that's a really fabulous resource, and man, it will just tell you everything you need to know about all of the different hive resources. The only thing it doesn't tell you is how to do something and sell it legally in this country, which is an issue because of FDA and Ohio Department of Ag. You're in Pennsylvania, but even they would be involved. The Pennsylvania agriculture would be involved as well.